Did you know that by the time this video ends, just about 30 minutes from now, over 90 Americans will have lost their lives to heart disease? That's almost one person every 20 seconds. And here's the part that should really make you pause. The majority of those people will be seniors, adults over the age of 60. Now, those numbers can sound overwhelming. But let me ask you this. If your car engine started making strange noises, or if the check engine light came on, would you ignore it? Probably not. You'd take it seriously because you know that small problems, if left untreated, turn into big ones. And yet, when it comes to our own hearts, the engine of our bodies, so many of us ignore the warning signs. We tell ourselves it's just indigestion, just fatigue, or just getting older. But here's the truth. Your heart rarely fails without sending signals first. The real tragedy is that these signals are often dismissed until it's too late. Let me share a story. A man named Richard, age 72, loved working in his garden. One afternoon, he noticed swelling in his ankles. He brushed it off, thinking it was because he had been standing too long. A few weeks later, he started waking up at night short of breath. Again, he told himself it was just old age catching up. Then came the day when he collapsed while carrying a watering can. At the hospital, doctors told him his heart had been struggling for months. Richard survived, but his life has never been the same, and Richard isn't alone. According to the American Heart Association, nearly half of seniors in the U.S. live with some form of heart disease. Many don't even know it until they land in the emergency room. The human heart is an incredible organ. Think about it. It has been beating nonstop, day and night, since before you were born. On average, it beats 100,000 times a day. By the time you reach 70, it has beaten more than 2.5 billion times. That's a lifetime of loyal service. But like any machine, it shows wear and tear over time. And just like an engine, when your heart starts sending out warning signals, ignoring them can be deadly. That's why this video is so important. Over the next 30 minutes, I'm going to share with you 10 surprising warning signs that your heart may be in trouble. Some of these signs will be familiar, but others may shock you. Swelling in your ankles, pain that spreads to your arm or jaw, constant fatigue, even changes in your nails or skin. Each one is your body's way of saying, "Pay attention to me." And here's the good news. When you know what to look for, you can act before it's too late. Recognizing these symptoms early gives you a chance to see your doctor, get treatment, and protect not only your heart, but your independence, your energy, and your time with the people you love most. So please, stay with me until the end of this video, because these 10 warning signs could be the difference between catching a problem early and facing a life-changing emergency. Now let's begin with the first sign your heart may be in trouble. Sign number 1. Stomach pain, indigestion, or nausea. When most people think about a heart problem, the first image that comes to mind is chest pain. But here's the surprising truth. For many seniors, a heart that's in trouble may first show up as stomach pain, indigestion, or nausea. Imagine this. You sit down to dinner, enjoy a meal, and later that evening you feel bloated, uncomfortable, maybe even a little nauseated. You think to yourself, "It must have been something I ate." You reach for an antacid, or you just lie down and wait for it to pass. But what if that discomfort wasn't from your stomach at all? What if it was your heart trying to warn you? This happens more often than you might think. Doctors call it referred pain. The nerves in your chest and digestive system are connected. So sometimes the brain can't tell the difference between indigestion and heart trouble. Instead of feeling sharp pain in your chest, you may feel it in your upper stomach. For seniors, especially women and those with diabetes, this can be one of the most common but most overlooked signs of a heart attack or serious heart disease. Studies from the American Heart Association have shown that up to 1 in 3 older adults experience stomach-related symptoms instead of chest pain during a heart attack. Here's how you can tell the difference between ordinary indigestion and something more serious: timing. If the discomfort comes on suddenly, especially when you're not eating or right after mild activity, it's suspicious. Associated symptoms. If nausea or stomach pain comes with sweating, shortness of breath, dizziness, or pain in the arm or jaw, that's a red flag. No relief from usual remedies. If antacids or rest don't improve the discomfort, it could be more than indigestion. Let me share a story. A woman named Carol, age 68, told me she woke up one night with what she thought was severe heartburn. She tried to walk it off, then drank water and went back to bed. By morning, the discomfort had spread to her chest, and she felt unusually weak. At the hospital, doctors told her she had suffered a mild heart attack overnight. The pain in her stomach was never about food. It was about her heart. And here's something else seniors should know. Nausea or vomiting, especially when combined with cold sweats, is often mistaken for the flu. Many people wait it out, thinking it's just a stomach bug. But if it comes on suddenly and feels different from anything you've had before, don't ignore it. The bottom line is this: not all heart problems start in the chest. For many seniors, the first clue may be in the stomach. If you feel unexplained nausea, persistent indigestion, or stomach pain that doesn't make sense, especially when it's new or combined with other symptoms, call your doctor or 911 right away. Acting quickly can save your heart muscle and your life. Sign number 2. Pain in the throat or lower jaw. When you think of heart trouble, the throat or jaw is probably the last place you'd expect to feel it. But here's something many seniors don't realize. Pain or discomfort in your throat or lower jaw can sometimes be a warning sign from your heart. Why does this happen? The answer lies in how your nerves work. The nerves in your chest, neck, and jaw are all closely connected. When your heart is under stress, like during reduced blood flow or a heart attack, your brain may misinterpret the signals. Instead of pain in your chest, you feel it higher up, in your throat or jaw. Doctors call this referred pain. Imagine this: you're chewing dinner and suddenly notice an ache in your lower jaw. Or you wake up at night with a dull, persistent pain in your throat. Naturally, you might think it's dental trouble, a sore throat, or even acid reflux. But here's the catch. If that pain comes without any obvious dental or throat problem, and especially if it appears alongside other symptoms like chest tightness, sweating, or shortness of breath, it may be your heart. I remember a patient named Linda, 70 years old, who thought she needed a root canal because of pain in her jaw. She visited her dentist twice, but the dentist couldn't find anything wrong. Weeks later, she collapsed while shopping. At the hospital, doctors discovered she had coronary artery disease and had suffered a small heart attack. That jaw pain was never about her teeth. It was her heart's cry for help. Here's what seniors should pay attention to: pain or pressure in the lower jaw that feels dull, heavy, or unusual. Throat discomfort that isn't linked to a cold, sore throat, or infection. Pain that comes on with activity, like walking or climbing stairs, and eases with rest. Pain combined with other heart-related symptoms, fatigue, nausea, sweating, or shortness of breath. This kind of pain can be sneaky because it doesn't seem connected to the heart at all. That's why it's so often missed. But remember, your heart doesn't always shout. It whispers through these unusual signals. So if you ever feel unexplained throat or jaw pain, especially if it's new, persistent, or paired with other warning signs, don't ignore it. Talk to your doctor or call 911 if it feels urgent. It could be the difference between catching a heart problem early or facing a dangerous emergency later. Sign number 3. pain or numbness in the arm, neck, back, or jaw. If there's one symptom most people associate with a heart attack, it's this: pain radiating into the arm. You've probably seen it in movies, someone clutching their chest, with pain shooting down their left arm. And while that image is true in many cases, the reality for seniors is often more complicated. Pain or numbness caused by heart trouble doesn't always stay in the chest. Because of the way nerves are connected, discomfort can spread into your arm, shoulder, neck, back, or jaw. Doctors call this radiating pain. Here's what makes it tricky. The pain may not be sharp. It can feel like pressure, heaviness, or even a dull ache. It can come and go. Sometimes it lasts only a few minutes, then fades, tricking you into thinking it's nothing serious. It doesn't always stay on the left side. While the left arm is most common, many seniors feel it on the right arm, across the shoulders, or even in the upper back. Let me share a story. A man named Robert, 74 years old, loved woodworking. One afternoon, he felt a strange numbness in his left arm while sanding a piece of wood. He thought he had just pinched a nerve or slept on it wrong. But the numbness returned the next day, this time with a dull ache in his neck. When he finally went to the doctor, tests showed he had severe blockages in 2 coronary arteries. That arm and neck pain were his warning signs, a warning that probably saved his life when he chose not to ignore it again. So how can you tell when pain or numbness is heart-related? Here are some clues. It appears or worsens with activity, like walking, climbing stairs, or even emotional stress. It eases with rest, but keeps coming back. It's paired with other symptoms: shortness of breath, sweating, nausea, or fatigue. It feels different from normal muscle or joint pain. Seniors often say, "It just didn't feel like my usual arthritis." And here's something especially important for women and people with diabetes. Sometimes the only symptom of a heart attack is pain in these areas, without any chest discomfort at all. That's why awareness matters so much. Think of it this way: your body is like a network of wires. When the heart struggles, the electrical signals can travel along different pathways, showing up in unexpected places. That's why your arm, neck, or back may hurt when the real problem is your heart. The takeaway is simple. If you feel unusual pain or numbness in your arm, neck, back, or jaw, especially if it's new, unexplained, or combined with other symptoms, don't ignore it. Call your doctor. If it feels sudden or severe, call 911. It could be your heart sending a clear message that it needs help. Number 4. Sign number 4. Pain or numbness in your legs. While walking now, let's talk about a sign that shows up not in the chest, not in the arm, but in your legs. Many seniors notice it every day, yet very few connect it to their heart. That sign is pain, cramping, or numbness in your legs when you walk. Picture this. You head out for a short stroll around your neighborhood. After just a block or two, you feel a tightness or cramp in your calves. You stop to rest, and within a few minutes the discomfort fades. You think to yourself, maybe it's just my age, or maybe it's arthritis. But then the same thing happens the next day and the next. This condition is called claudication, and it's often a warning that your arteries are narrowing, not just in your legs, but possibly in your heart as well. It's part of a disease known as peripheral artery disease, PAD. Here's why it matters. The arteries in your legs are like highways carrying blood and oxygen to your muscles. When plaque builds up, those highways narrow. As you walk, your muscles demand more oxygen, but the blood can't flow fast enough through those blocked arteries. The result? Pain, cramping, or numbness that forces you to stop. But here's the connection that many seniors miss. If the arteries in your legs are clogged, there's a good chance the arteries in your heart are clogged too. In fact, Research shows that seniors with PAD are at much higher risk of heart attack and stroke. Let me share a real example. A man named Henry, 71, loved fishing. But he noticed that just carrying his tackle box to the lake left his legs aching. He blamed it on bad knees. Finally, his daughter convinced him to see a doctor. Tests revealed severe blockages in both his leg arteries and significant narrowing in his coronary arteries as well. By treating the PAD, doctors also prevented a potential heart attack. So how can you recognize when leg pain is more than just aging joints? The pain or numbness appears only when you walk or exercise and improves when you rest. It tends to happen in the calves, thighs, or buttocks. Your feet may feel colder than the rest of your body, or your skin may look pale or bluish. In advanced cases, small wounds on your feet heal very slowly. This isn't just about discomfort, it's about circulation. When your arteries can't carry enough blood to your legs, they may not be carrying enough to your heart either. So if you've noticed pain, cramping, or numbness in your legs that keep showing up during walks, don't shrug it off as just age. Talk to your doctor. It could be one of the clearest signs that your heart and blood vessels need attention. Sign number 5. Swelling in your ankles, feet, or abdomen. One of the clearest signs that your heart may be struggling is swelling in your lower body, especially your ankles, feet, and sometimes even your belly. Think about the last time you took off your socks at night. Did you notice deep marks pressed into your skin? Have your shoes felt tighter than usual, even though you haven't gained weight? Maybe your waistband feels snug, or your stomach looks bloated, even when you haven't eaten much. These may not just be signs of aging or water retention. They could be signals from your heart. Doctors call this swelling edema. It happens because when the heart can't pump blood efficiently, pressure builds up in your veins. That pressure pushes fluid out into surrounding tissues, especially in the lowest parts of your body, where gravity pulls it down, your ankles and feet. In some cases, fluid even collects in the abdomen, making you feel bloated or heavier. I once met a gentleman named George, age 70. He thought his ankles were swelling because he had been standing too long at his granddaughter's graduation. But when he noticed it happening almost every day, even when he rested, he went to see his doctor. The diagnosis? Early-stage heart failure. His swelling was one of the very first warning signs that his heart was no longer pumping as strongly as it should. Here's what you should watch for. Swelling that gets worse throughout the day and improves after lying down at night. Socks or shoes leaving deep impressions on your skin. Rapid weight gain, 2 or 3 pounds in just a couple of days without a change in diet. A feeling of fullness or tightness in your belly, sometimes making it hard to breathe deeply. Now, to be clear, not all swelling means heart trouble. It can also come from kidney or liver problems, varicose veins, or even certain medications. But for seniors, especially those with high blood pressure, diabetes, or a history of heart disease, persistent swelling is often connected to the heart. The biggest mistake many people make is ignoring it. They think, it's just part of getting older, or it's only because I sat too long. But when swelling becomes a regular pattern, it's your body sending a signal. The takeaway: if you notice swelling that keeps coming back or gets worse, don't ignore it. Talk to your doctor. Simple tests can reveal whether it's your heart, and early treatment can prevent much bigger problems later on. Sign number 6, persistent cough or wheezing. When most seniors think about a cough, they think about a cold, allergies, or maybe asthma. But here's something many people don't realize. A cough that doesn't go away, or wheezing that makes it hard to breathe, can actually be a sign that your heart is struggling. Why does this happen? It all comes down to how your heart and lungs work together. Your heart pumps blood throughout your body, and part of that blood passes through the lungs to pick up oxygen. When your heart isn't pumping effectively, blood can back up into the veins of the lungs. That extra pressure causes fluid to leak into the airways. The result? A persistent cough, wheezing, or even a rattling sound when you breathe. Let me paint a picture. Imagine sitting in your recliner watching TV at night. You notice you've been coughing for weeks. It's not a dry cough from allergies. It's wet, sometimes producing frothy or pink-tinged mucus. Or maybe you notice wheezing when you climb the stairs, even though you've never had asthma in your life. These are red flags that your heart, not your lungs, may be the problem. I remember a patient, Margaret, age 73. She came in thinking she had chronic bronchitis, but after tests, we discovered her heart was failing to pump blood efficiently, and fluid had built up in her lungs. That cough was her heart's way of sounding the alarm. Here are signs that your cough or wheezing may be heart-related. It lingers for weeks and doesn't improve with usual cold or allergy remedies. It gets worse when you lie down, sometimes waking you up at night. You notice shortness of breath with even mild activity. In severe cases, you may cough up frothy or pink mucus. This is a medical emergency. Many seniors shrug off these symptoms, blaming age or seasonal changes. But remember, your heart and lungs are partners. When one struggles, the other feels it. A cough may seem harmless, but when it lingers, it could be your body warning you that your heart is under strain. The key takeaway? If you have a cough or wheezing that won't go away, especially if it's worse at night or paired with shortness of breath, don't ignore it. Talk to your doctor right away. Treating the underlying heart issue can often make the cough disappear and protect your heart from further damage. Sign number 7. Cold, unusual. Sweating. Sweating is normal when you're exercising, when it's hot outside, or even when you're anxious. But what if you suddenly break out in a cold, clammy sweat while you're sitting quietly in your chair, watching TV, or lying in bed? That kind of sweating isn't normal, and for seniors, it can be a red flag that your heart is in trouble. Why does this happen? When blood flow to the heart is blocked, the body goes into shock mode. The nervous system releases stress hormones like adrenaline to try to compensate. This surge triggers sweating, even though you're not exerting yourself. Many people describe it as a sticky, clammy feeling, often combined with dizziness or nausea. Let me share a story. A man named Thomas, 69, woke up one night drenched in sweat. He thought it was just a night sweat, or maybe a side effect of something he ate. But he also felt weak and slightly nauseated. His wife insisted on calling 911. At the hospital, doctors found he was having a heart attack. That unusual sweating was one of his very first warning signs. Here's what you should look for. Sudden sweating that feels cold and clammy, not warm like after exercise. Sweating paired with other symptoms like chest pressure, shortness of breath, nausea, or jaw pain. Breaking out in sweat during rest or mild activity when there's no clear reason for it. The danger is that many seniors dismiss this. They think, it's just my age, or maybe it's my medication. But remember, your body is smart. If you start sweating heavily for no reason, especially if it comes with other warning signs, your heart may be calling for help. And here's an important note. Cold sweats during a heart attack often show up before chest pain. In fact, some seniors never feel chest pain at all. Sweating may be their only symptom. The takeaway is simple. Never ignore sudden, unexplained sweating. If you find yourself drenched without reason, especially if you also feel weak, dizzy, or nauseated, treat it as a medical emergency. Call 911 right away. Acting fast can make the difference between life and death. Sign number 8. Trouble sleeping or waking up. Often at night. For many seniors, sleep can already be a challenge. But here's something you might not expect. Difficulty falling asleep or waking up often during the night can sometimes be linked to heart problems. Why would the heart affect sleep? Let's break it down. When your heart is struggling to pump blood effectively, fluid can back up into the lungs. This makes it harder to breathe when you lie flat. Seniors often describe this as needing extra pillows to prop themselves up or waking up suddenly in the middle of the night gasping for air. Doctors call this paroxysmal nocturnal dyspnea, a fancy term for shortness of breath that wakes you up. Sometimes it's not dramatic gasping. It might simply be restlessness. You toss and turn, unable to get comfortable, or you wake up multiple times to use the bathroom because your kidneys are trying to get rid of the extra fluid your heart can't handle. I remember one of my patients, Evelyn, age 72. She told me she hadn't slept through the night in months. At first, she thought it was just insomnia or stress. But when we looked closer, we found her heart wasn't pumping properly and fluid was building up in her lungs at night. After treatment, not only did her heart improve, she finally started sleeping peacefully again. Here are signs that poor sleep may be connected to your heart. Needing to sleep with multiple pillows to breathe comfortably. Waking up suddenly with shortness of breath or coughing. Feeling unusually tired during the day despite going to bed on time. Frequent nighttime urination linked to fluid shifts in the body. Now, of course, not every sleep problem is heart-related. Many seniors have insomnia from stress, medications, or simply changes in sleep patterns with age. But if your sleep problems are new, persistent, and combined with other symptoms like swelling, coughing, or fatigue, they may be warning signs of heart trouble. The key takeaway? Don't ignore sleep changes, especially if they come with breathing issues or fatigue. Your heart works hardest at night to keep your body running smoothly. If it's struggling, it often shows up when you try to rest. So if you've been waking up often, gasping for air, or relying on more pillows than before, don't just assume it's old age. It may be your heart whispering for help. And the sooner you check, the sooner you can protect both your heart and your sleep. Sign number 9. Changes in your skin. Pale, gray, or bluish spots. When we think about heart problems, we don't usually think about our skin. But your skin is like a mirror of your circulation. If your heart isn't pumping well, it often shows up on the outside of your body through changes in skin color. Have you ever looked in the mirror and noticed your skin looking unusually pale, almost gray, or dull? Maybe you've seen bluish or purplish spots on your lips, fingers, or toes. These changes may not just be cosmetic. They could be signs that your heart isn't delivering enough oxygen-rich blood to your tissues. Here's why this happens. Your heart's job is to pump oxygenated blood through your arteries. When it struggles, because of blocked arteries, weak pumping power, or poor circulation, your skin and extremities are the first places to suffer. Without enough oxygen, skin can look pale, ashy, or even slightly bluish. Doctors call this cyanosis. I remember a patient named Harold, 75 years old, who came in because his wife noticed his lips sometimes looked bluish in the morning. He thought it was just the cold weather, but tests showed his heart wasn't pumping effectively, and fluid had begun building up in his lungs. Those subtle color changes in his skin were his body's way of waving a red flag. What should you look for? Skin that looks unusually pale or gray, even when you're not sick. Bluish lips, fingertips, or toes, especially in cold weather or after light activity. Purplish or dark spots that appear on the skin without obvious bruising. Skin that feels cooler than normal, especially in your hands and feet. It's easy to dismiss these signs as poor circulation or just aging skin. But the truth is, they may point to a heart that isn't pumping enough blood to keep your tissues healthy. And here's an important reminder. These changes are often gradual. You may not notice them until someone else points them out. That's why it helps to pay attention to little details, like the color of your lips in the mirror, or whether your fingers look unusually dark after walking outside. The bottom line is this. If you notice unusual skin changes, especially if they're new or combined with other symptoms like fatigue, swelling, or shortness of breath, don't ignore them. Your skin may be showing you what's happening inside your heart. Sign number 10. Unusual nail changes. Curving or becoming brittle. Of all the signs we've talked about, this one might surprise you the most. Your fingernails and toenails can actually reveal a lot about your heart health. Have you ever looked down and noticed your nails starting to curve more than usual, almost wrapping around the tips of your fingers? Or maybe they've become unusually brittle, breaking easily, or developing ridges. These changes are not just about aging. They can sometimes be linked to circulation problems and heart disease. Here's why. Healthy nails need a steady supply of oxygen-rich blood to grow strong and smooth. When your heart isn't pumping efficiently, or when your arteries are narrowed, less oxygen reaches the nails. Over time, they can start to change shape or texture. Doctors sometimes call this clubbing of the nails. One of my patients, Eleanor, age 76, told me she thought her brittle nails were just due to getting older. But when we checked her circulation, we discovered she had peripheral artery disease, blocked arteries in her legs. Her nails were one of the earliest clues that her blood flow wasn't what it should be. Here are changes to watch for in your nails. Curving or rounding of the nails, especially if they look more bulbous than before. Brittle or breaking easily, even if you've always had strong nails. Ridges or unusual lines that appear without injury. Nails that look pale or bluish, suggesting reduced oxygen supply. Now, to be fair, not every nail problem means heart disease. Nutrition, aging, and other conditions like thyroid problems can also affect nails. But when nail changes happen suddenly, or along with other heart-related symptoms like swelling, fatigue, or shortness of breath, they should not be ignored. Think of your nails as tiny windows into your circulation. They're far from the heart, so if they're not getting enough blood and oxygen, chances are other parts of your body aren't either. The key takeaway is this. If your nails start changing shape or becoming brittle without clear reason, mention it to your doctor. It might seem like a small detail, but it can be an important piece of the bigger picture of your heart health. Before we wrap up, let me share with you one powerful food that can do wonders for your heart. The avocado. Now I know what you might be thinking. Avocados are high in fat. But here's the important part. It's the good kind of fat. Avocados are rich in monounsaturated fats, the same heart-healthy fats found in olive oil. These fats help lower bad LDL cholesterol and raise good HDL cholesterol, keeping your arteries flexible and clear. Avocados are also packed with potassium, which helps control blood pressure, a critical factor for seniors. In fact, a single avocado has more potassium than a banana. And controlling blood pressure means protecting your heart from unnecessary strain. But that's not all. Avocados contain fiber, antioxidants, and magnesium, all of which support circulation, reduce inflammation, and improve overall heart function. What I love most is how easy they are to include in a senior's diet. Spread mashed avocado on whole grain toast instead of butter. Add a few slices to your salad for creaminess without the guilt. Or blend it into a smoothie with spinach and berries for a nutrient-packed breakfast. Research from the American Heart Association has shown that eating even 2 servings of avocado per week can lower the risk of heart disease by more than 20%. That's a huge benefit from such a simple, delicious food. So if you're looking for a superfood that can help keep your heart strong well into your 70s, 80s, and even 90s, make avocados a regular part of your diet. Your heart has been working faithfully for you every second of your life. And as we've seen today, it always tries to warn you when something isn't right, through signs like unusual stomach pain, swelling in your ankles, or even changes in your skin and nails. The key is to listen, Recognizing these signals early and acting on them can mean the difference between catching a problem in time or facing a life-threatening emergency. And remember, small steps make a big difference. Adding heart-healthy foods like avocados, staying active, and paying attention to your body's whispers can protect not just your heart, but your independence and your joy in life. So take care of your heart, because protecting it isn't just about living longer. It's about living better, so you can enjoy every moment with your children, your grandchildren, and the people you love most. If this video helped you, please subscribe and explore our other videos on senior health and stroke prevention. Knowledge is power, and together, we can keep your heart strong for many years to come.